understand it and they can't see it and they can't.
You know, because I mean,
Let me read this right here. This is it says this is the Wikipedia page. It says major depressive disorder, also known as clinical depression, is a mental disorder characterized by at least 2 weeks of pervasive low mood, low self-esteem, and loss of interest or pleasure in normally enjoyable activities. Introduced by a group of U.S. clinicians in the mid 1970s, the term was adopted by the American Psychiatric Association for the symptom cluster under mood disorder in the 1980 version of the Diagnostic and Statistical Manual of Mental Disorders, and has become widely used since. The diagnosis of major depressive disorder is based on the person's reported experiences, behavior reported by relatives or friends, and the mental status of examination. There is no laboratory test for the disorder, but testing may be done to rule out physical conditions that can cause similar symptoms. The most common time of onset is in the person's 20s, with females affected about twice as often as males. The course of the disorder varies widely from one episode lasting months to a lifelong disorder with recurrent major depressive episodes. Those with major depressive disorder are typically treated with psychotherapy and antidepressant medication. Medication appears to be effective, but the effect may be significant only in the most severely depressed. Hospitalization, which may be involuntary, may be necessary in cases with associated self neglect or a significant risk of harm to self or others. Electroconvulsive therapy may be considered if other measures are not effective. Major depressive disorder is believed to be caused by a combination of genetic, environmental, and psychological factors, with about 40% of the risk being genetic. Risk factors include a family history of the condition, major life changes, certain medications, chronic health problems, and substance use disorders. It can negatively affect a person's life, work life, or education and cause issues with a person's sleeping habits, eating habits, and general health. Major depressive disorder affected approximately 163 million people, 2% of the world population in 2017. The percentage of people who are affected at one point in their life varies from 7% in Japan to 21% in France. Lifetime rates are higher in developed world, 15% compared to the developing world, 11%. The disorder causes the second most years lived with disability after lower back pain. So the second most years lived with disability after lower back pain. So like they live with this their whole life or large portions of their life. Let me read a little bit more. It says symptoms and signs. Major depression significantly affects a person's family and personal relationships, work or school life, sleeping and eating habits, and general health. A person having a major depressive episode usually exhibits a low mood, which pervades all aspects of life and an inability to experience pleasure in previously enjoyable activities. Depressed people may be preoccupied with or ruminate over thoughts and feelings of worthlessness, inappropriate guilt or regret, helplessness or hopelessness. Other symptoms of depression include poor concentration and memory, withdrawal from social situations and activities, reduced sex drive, irritability, and thoughts of death or suicide. Insomnia is common in the typical pattern. A person wakes very early and cannot go back to sleep. Hypersomnia or oversleeping can also happen. Some antidepressants may also cause insomnia due to the stimulating effect. In several cases, depressed people may have psychotic symptoms. These symptoms include delusions or less commonly hallucinations, usually unpleasant. People who have had previous episodes with psychotic symptoms are more likely to have them with future episodes. A little bit more. It says a depressed person may report multiple physical symptoms such as fatigue, headaches, or digestive problems. Physical complaints are the most common presenting problem in developing countries, according to the World Health Organization criteria for depression. Appetite often decreases, resulting in weight loss, although increased appetite and weight gain occasionally occur. Family and friends may notice agitation or lethargy. Older depressed people may have cognitive symptoms of recent onset, such as forgetfulness and more noticeably slowing of movements. Depressed children may often display irritability rather than depressed mood. Most lose interest in school and show steep decline in academic performance. Diagnosis may be delayed or missed when symptoms are interpreted as normal moodiness. Elderly people may not present with classical depressive symptoms. Diagnosis and treatment is further complicated in that elderly are often simultaneously treated with a number of other drugs and often have other concurrent diseases. Am I putting you out to sleep?
Mm-mm.
Um,
I mean, it's a very interesting thing, especially dealing, actually. I mean, because this is what especially for me. Like, I'm like, what are some of the things that I'm missing that maybe people are going through, and like there's other things that usually goes along with that. Uh, Having depression, especially when it's you know, well, when we talk about suicide, I mean, is that the number one thing that causes suicide is depression itself, or is there any other things that we might relate to it that's not? Uh,
well, you're not in a healthy mind state if you're thinking
yes,
about offing yourself.
of course. I mean, that's easy to tell, but what I'm saying is, as far as you
So
know,
that's depression is one of the main. It's a mood disorder. So yeah, I would say in most cases that will be the case. You're psychologically not right, you know, and you're just having a bad moment. Sometimes it's just a moment, and you make a
but if those moments persist longer and longer, is that's when start to debate on worthiness.
yeah psychomet. I might read this what Doc sent me, but the related. Let me read this right here. Did I share this? Am I sharing this? Okay, yeah, mood disorder. So this is related. So it's like a lot of this is it's you know not even defined very well. You know what I mean? Like this is kind of like a thing that they're just trying to figure out now. This is it's not a solid science, if you will, and and they don't have very good
Well,
things to deal with. They were talking about the drugs, then they were talking about electric therapy, and what I'm saying, locking them
well,
up. These are
well,
their solutions.
I know, and one of the weirdest things maybe it's weird, maybe it's not, because I mean, of course, we're being taught that we should focus more on our mental health and this, that, and the other. But I mean, if we're seeing an uptick of black men wanting to harm themselves or to kill themselves with the uptick of mental health, is it possible that what we were doing before, ignoring a lot of these things, kept us living?
Hmm. That's. I mean, I think I get what you're saying, but you can't ignore depression because that's what leads to the people offing themselves. It festers and it it gets out of control. Let me read this. It says mood disorder, also known as affective disorder, is any group of conditions of mental and behavioral disorder where are disturbance in person's mood in the main underlying feature. The classification in the Diagnostic and Statistical Manual of Mental Disorders, DSM, an international classification of diseases. Mood disorders fall into 7 groups, including abnormally elevated moods such as mania or hypomania, depressed mood, of which the best known and most researched is major depressive disorder, alternatively known as clinical depression, unipolar depression, or major depression, and moods which cycle between mania and depression, known as bipolar disorder, formerly known as manic depression. There are several subtypes of depressive disorders or psychiatric syndromes featuring less severe symptoms such as dysthymic disorder, similar to MDD but no longer lasting and more persistent, though often milder, cyclothymic disorder, similar to but milder to BD. In some cases, more than one mood disorder can be present in an individual, like both bipolar disorder and depressive disorder. If a mood disorder and schizophrenia are both present in an individual, this is known as schizoaffective disorder. Mood disorders may also be substance induced or occurred in response to a medical condition. Yeah.
Hmm.
Let me read this one line right here. English psychiatrist Henry Maudsley proposed an overreaching category of affective disorder. The term was then replaced by mood disorder, as the latter term refers to the underlying and longitudinal emotional state, whereas the former refers to external expression observed by others. Okay, yeah. So it's the basis is, moods, right? Um, Cycling between mania and depression. Um, that's the baseline, the mood swings, if you will, and how people are not able to enjoy pleasures or whatever. They can't seem to be happy for nothing. Like they can't enjoy anything.
Say, bro. I I don't want to say too much because it'll reveal.
I'm telling you, man, that's why I'm being careful too, because a lot of people really close to me, you know, and but that's the point of this. It's so many of us. Like I say, I think that all of us, we're on suicide watch. That's the name of the show. We're on suicide watch.
Yeah.
All of us.
Well, and I mean, I think that because I mean, I think when you have a certain mindset, when you like, all right, knowing thyself really does help and change a lot of these things. Like actually, like you understand who you are and how like how you know what I'm saying. You're not confused about who you are. I think that's one big step closer to sanity. But as far as setting boundaries with yourself, like things like, because I mean, I'll never commit suicide. If something happened to me, you know, accidental death, believe me, I didn't, I didn't do it on purpose. You know what I'm saying? But I do think that like we all have to somewhat know, at least if you don't know who you are. Start off by knowing who you're not. You know what I'm saying? Like that'll definitely help you a long way. You know what I'm saying? But I think you gotta definitely set some parameters of what I'm saying, what's cool, what's not. Like me going that far, like he made that an option too many times to where he went through with it.
But see, we don't know what we're capable of. It was the freaking Kanye West song. He said, what's the name of the song? He's
We know
like,
what we're capable
sometimes
of. That's a
I'm
cop out.
scared myself. No, bro, you don't have control when your mind. That's why I think that you don't understand, because you don't have control. Your mind is everything, bro. The way your mind
All right, no,
works,
all right. You know
that's
what? I forget. I don't have this problem, so I gotta look back because I know all this. I know how to keep myself from being that.
how
So
can you
that's
be
what
so sure?
I just am.
because your mind could be telling you that
Can be telling me what?
that's true, and it's not. You get what I'm saying?
No, because see that's the thing. Like I don't trick my mind into thinking that it runs some like look, I
How much
control
control
it
do you have over your subconscious?
a lot because control most of what I put in that like what I do sleep hypnosis. I do different things to control myself. Instead of allowing other people to throw things in the loop, I do it personally. So that way, there is some guidance, some positive guidance.
But your mind is like an iceberg. The conscious mind is the little part that's poking out of the water. The subconscious mind is the huge rest of it. It's driving the stuff like when you're breathing and when your heart is
Yes,
beating. It's
yes,
you don't have control over that. That
but
by nature you don't, because that's the biology of it.
see, but there's so many human hacks. It's just like a computer. Like you can like it's programmed to work a certain way, but there's a way to cross or to jump levels in it if you understand if you understand how certain things work. There's a way to jump over a lot of the barriers. And the thing about it is, knowing that you don't know everything, but when you know something, you try to do your best to try to keep yourself in balance. Like I mean, that's like it's work. Like I mean, being free, having all of these, like being able to see the world a certain way isn't just a happenstance. No, you do the programming yourself.
Doc says self deletion watch. And that's kind of the next level of where I'm going with this, because it's so many people going through this. And that's the reason why I'm exploring, challenging you, Pat, on the idea that you could be depressed without knowing it. You know what I'm saying? Not aware of it. I'm not
Well,
saying that you are.
no,
I'm saying that how would you know?
because I'm always like analyzing and reanalyzing myself. Like I don't like I test myself. Like I do self checks on myself all the time. Like and that's one of the things like I think because look, somebody I was talking to real close to me that somebody that was close to them um got sick, was going to the hospital, and I could sense a little distress or whatever. So I asked them, I was like, "Are you okay?" They said, yeah, yeah." I said, "Well, look, whether like if you find cool, that's great. If you're unsure of what you're feeling, that's cool too. But and then there's like, oh wait a minute, oh there you go being a therapist. This is yes, because I practice on myself all the time.
And we
Like
need it all the time. We need it all the time. Um, Let me read this right here. What Doc sent. This is pretty cool right here. I think this will synthesize the conversation. It says common causes of suicidal feelings. Struggling to cope with certain difficulties in your life can cause you to feel suicidal. These difficulties may include. So this is a list right here. I like this. It says mental health problems is the first one. So we were talking about depression. It says bullying or discrimination, including racism. Bullet. It says different types of abuse, including domestic, sexual, or physical abuse. Another one, it says bereavement, including losing a loved one to suicide. Whoa.
well
No,
look, oh go ahead, go ahead.
yeah, let me finish the bullets. It says
Yeah.
the end of a relationship, long-term physical pain or illness, adjusting to a big change such as retirement or redundancy, money problems, dun dun dun, housing problems including homelessness, isolation or loneliness, being in prison, feeling inadequate or a failure, addiction or substance abuse, pregnancy, childbirth, or postnatal depression, doubts about your sexual or gender identity, cultural pressure such as forced marriage, other forms of trauma. I don't think that